Good afternoon and welcome to today's Y Sports webinar, The Future of Public Sector Leisure. Thanks for taking time out of your day today. Hopefully we will have some positive learning as we go through the session today. I'm James Foley, Commercial Director for Alliance Leisure, and I have the privilege of introducing today's session. Having helped shape the content, I'm pretty sure we're all in for a treat. So, public sector leisure, does it really matter? Thankfully, we have some really great panellists with us today to help shape that debate. So without further ado, let's meet them. Kenny is a leading light within ukactive, a chartered physiotherapist in his early career and ahead of his time as a musculoskeletal specialist. Kenny is leading the charge within ukactive, championing the health of the nation at a national level, promoting wellbeing through active lifestyles. Mark and I share common ground on so many levels, having started out as sports development peeps in our career. Mark, I've had the opportunity to work with on recent developments in Harrogate, and we both share a passion for people and communities. Mark's not only one of the most intelligent people I know, he's also one of the most humble and down to earth, which is a quality I admire very greatly. And last but by no means least, Andy and I have known each other for probably longer than we would care to remember. And we are, of course, both only 27. Andy is one of the most respected colleagues in our industry and brings a wealth of experience from the public, private and third sector. Most latterly, chairing GM Active and now leading the charge as a director at Miova. Hopefully I've said that right, Andy. I'm sure you will agree the combined experience of our panel is clear to see. So how will today's session flow? Kenny will firstly give us an overview of the practical policy on a national level that ukactive are undertaking to drive change. Mark will run us through Brimhams' Harrogate Revitalise and Reinvent principles on the pivot from conventional leisure to effective health and wellbeing. Andy will build on that pivot around the work undertaken in GM Active in Manchester with the 10 Greater Manchester local authorities in partnership with Sport England. Each of our guests will be presenting their reasons for why they believe the health of the nation matters, and as does the public sector leisure sector. We do, of course, want you to play your part in today's webinar. You should be able to see that there is chat functionality on the platform, and we're encouraging you to engage using the chat function. We'll be picking up comments along the way. Thank you for that, Richard, so that we can have an active discussion with you as part of the session. We'll also be issuing out a number of polls, so some questions for you incoming. We'd love to hear your thoughts back to that, which will hopefully help shape some closing dialogue as we get to the latter part of this session. And I would urge you to think what your call to action is of being on this webinar. We all attend a number of webinars throughout our careers, and there are sometimes great things to take from them. There are sometimes learning points to take, but I'm urging you to take that back to your teams from anything you find of value today or pick up with any of the panelists afterwards. So my first memory of what you would call a typical leisure centre was Howbridge Sports Centre in Wigan. A rite of passage for me was going swimming on a Saturday morning, chips and gravy, apologies, I am from up north, playing football and then getting back in the leisure centre at the earliest convenience. And yet it's clear to see that much has changed since 1892. It's also clear to see that much has changed from when I was running around the leisure centre in the 1980s. Putting pandemics and pivots to health aside, it's clear we're in very challenging times. When we look at spending on public sector leisure, the 1.4 billion mark, I've not put the figures in for social care and national health because they're just astronomical. But what we do have is a national economic climate where we have government debt at almost the balance of the GDP of the economy, as much borrowing as we are bringing in as an economy. When we're talking about the trillions at 2.65, that's more than double that it was at any point from the 1980s, to the financial crisis of 2008. It's clear we're in very challenging times. Against that backdrop, we also know that in our 3,000 plus leisure centres across the UK, we have the ability to make a difference. We have leisure centres delivering almost 2/3 of cancer pre-post rehab in the UK. We deliver almost £10 billion worth of social value in health improvements in public sector leisure. And yet against that and the economic backdrop that we have, recent survey undertaken by the LGA only last month, February 2024, has shown that leisure services are under threat, with more than 55% of local authorities realising that target budget reductions are going to be required in their sport and leisure facilities. So something's got to change. We know that. How do we go about that? So let's start the debate. Whilst Kenny is readying, we're going to kick off the first poll of our session. And with that, I'm going to pass over to Kenny, who will take us through the national landscape from a ukactive perspective. Thanks, Kenny.
Afternoon. Can you hear me, John?
Indeed.
Great. Great introduction. And thanks for having me. I don't think I've ever been called a leading light before, so I'll go with that. I need to progress the slide here. There I am. So it's in the spirit of this webinar's title, Enabling Change Through Health and Wellbeing Facilities. I thought I'd take you through the landscape, as John said, the drivers, the policy elements around here, and then we're going to dive deeper into the pioneering stuff that Mark and Andy are doing with some questions afterwards. But I thought it'd be a good place to start to look at the global aspects of what's going on around the physical activity sector and policy. And I want to highlight some of the work that we are doing on the sector's behalf, on your behalf, on a national level. And there's some things that we'll be talking about that I'm not going to apologize for the language too much, because it's language that us as a sector need to start adopting to enable this change for health and well-being with these facilities. Let me progress this. Okay, so what we want to do as a sector is a lot there, but I just circled the 20% of the population by 2030. Now, enabling change through these facilities is going to allow that to happen, because we need to attract a more diverse population I'm going to talk about in a moment. So if we want to get 20% of the population by 2030, that's what we're going to have to happen. People with long-term conditions, look at pathways from the health system, look at people self-referring for health. We did a poll recently, and most people who are coming to the gyms are doing it for health reasons, unsurprisingly. But many are doing it to manage their long-term conditions as well. I pop this in here because folks who do system analysis have a great belief in leveraging points. And these are points in a complex system. This ecosystem, for instance, that we work in, the physical activity sector, and government, charities, nonprofits, NHS. If you shift one small point, it can lead to significant changes. So the point with putting this up here is to illustrate some of the leveraging that's going on in our ecosystem at the moment that we are doing, you are doing, but we're trying to do on a national basis. And where we're focusing our efforts at the moment are the health-related conversations. And they're much more mature than they used to be within government agencies and healthcare charities, Richmond Group of Charities, for instance. They are looking at our sector now as a potential place for prevention and treatment, so primary and secondary prevention of health conditions. Some of you on this call are influencing these areas, and this is called places to intervene in the system. And I'll pop. I think we got a link to this this PDF as well if you want to explore this. But it's just to give you an idea of what's going on in the sector on your behalf. Some of these organizations, speaking of leveraging points, are relationships that you will have. But what we're trying to do with these groups is to leverage the policy around physical activity as a healthcare option. And what seems to be happening is there's a collective approach that's starting to happen. So there's some silos that are being joined up for the first time. And some of the success of that leveraging that I spoke about is now allowing us to have a conversation with NHS, for instance, with the Department of Health and Social Care. And there is a serious conversation occurring now about how we can be part of that system. So, that first poll, well, the reason why I put that in is it's an important piece of governmental work that we need to be aware of. Some of you might be aware of the major condition strategy, but basically government's taken a decision to develop a major condition strategy, which is basically a blueprint for improving the outcomes over the next 5 years, I think it is, covering cancer, heart disease, MSK disorders, mental health and dementia, as well as respiratory diseases as well. So it's a multi-morbidity approach, and this is about increasing access to healthcare in the community, like our services, like you guys. And the bulk, well, John mentioned it already, the bulk of cancer prehab occurs in our spaces, for instance. And a lot of cardiac rehab already occurs in our spaces, as well as respiratory rehab around the country. So we link into this major condition strategy. We're going to be talking that language. And if we tailor our services to these major condition strategies, then I think we have a chance to enable that change in these facilities. So bear with me for a moment, but there's a couple of governmental departments you might switch off seeing them. However, there's a joint health and work unit that is those two departments combined, not the musculoskeletal joint, a cross-departmental working department that's now been developed to improve the health and employment outcomes for disabled people, people with long-term conditions. This is a conversation we're having at the moment, and these are the people now who are taking some interest in what we are doing as a sector. Some of the good stuff that's occurring already in the sector is helping this group with economic inactivity. And this is important as well because a lot of the governmental speak at the moment and the health initiatives and the major condition strategy is tailored around the context of economic inactivity. They want people to stay at work, get back to work, be happy at work, and have good work as a healthy option. So there's a big push now to get people back into work and support them. And that's what that unit is doing right now. I was just about to say next slide, please, but that's me. So I just wanted to highlight a couple of things as well as we go along. This is one I bring up because one of our operator members has now got a nurse on their payroll and is seeking to appoint a GP with as well, view and hiring a data analyst as well. And that's part of something called the Additional Roles Reimbursement Scheme. And it supports the primary networks out there. So it's a patch of NHS, of which ICS is a part of. And they provide funding for reimbursable roles. So I would encourage the sector to talk to the local healthcare about these roles, because there's 12 new roles, including the one I've circled there, health and wellbeing coaches. And that's relevant to us. And that will help us become part of the health and wellbeing facilities we want to be. Just to go back to the joint work and health unit for a second, they developed a Work Well program, which again is around employment advisors, around job centers. But there's a dotted line to us in the services that we offer, positioning us in the local partnerships of the integrated care boards is going to be pretty important. And then April 2nd, there'll be an announcement to announce 15 Vanguard partnerships. Those are the integrated care boards, the old CCGs, if nobody's familiar with the integrated care boards. Those are the administrative local NHS entities. And they are going to be awarded governmental money to help with inactivity, economic inactivity. So you should be talking to your local one about that. And even before that announcement comes out, if those 15 are successful. So I thought that would be important to raise in the whole context of this discussion today. So Not sure if you've heard of NASP before, but they're a national charity that champions social prescribing. They basically support and connect communities and organizations for the benefit of their health and well-being. So we're doing some mapping at the moment and bringing your services in the sector to them so that they know where they can signpost people who are ready for physical activity to help with their health and well-being. So by giving local access to local personalized care like that, there is a drive toward tackling inequalities because these people would never interact with us. So linking to social prescribing is really, really important. Another thing that we're doing is going around the country to identify, and there's more than this list, but these are some of the engaged ones at the moment, exemplar integrated care systems that work hand in glove with physical activity. And there's a list of a few that we're starting to talk to and work with, and go around to bring local government, devolved government together with healthcare, with the sector, physical activity, interventions that might support their local healthcare initiatives and goals. So again, all of this that I'm talking about today is about how we enable that change for our facilities and that mature conversation around health. And this last slide kind of sums it up for me a little bit. You know, we talk about the hard to reach people, and that is really, really important. However, I think we probably need to look at the other end of it. Is it hard to reach people, or is it hard to reach services? So flying the flag for the industry to bring these services to healthcare is really, really important. So that's a lot of landscape discussion there, high level, but it's something that you should be aware of what the physical activity sector, where the physical activity sector can go, is going, and how we can link to healthcare support. And I am going to move on to Mr. Tweedie.
Thank you so much, Kenny. That was brilliant. So from high level, big ticket national strategy stuff, right down to the coalface with me, everybody. So Mark Tweedie, Managing Director of Brimhams Active. We run leisure and some community services in the Harrogate area, and we're a local authority trading company that are controlled by North Yorkshire Council. We have 10 facilities. Our turnover is about 9 million a year. And we're doing a range of kind of good things, really, not dissimilar to lots of really progressive leisure operators around the country. And I've had a quick look through the attendance list, and there's lots of familiar names on there today attending. And I know everybody really cares about what we're trying to achieve, which is to get the nation more active and improve health. I just need to correct James, actually, just from a statement he made on his introduction. He described himself as a northerner and likes chips and gravy, but he's actually from Wigan, so he missed the pie from the chips and gravy. So that's a key point, really, for
Thank
everybody.
you for the clarification, Mark.
Yeah, I didn't want you getting lynched on the streets of Wigan at some point. Missing the pie, James.
I'm safe. I will let you carry on. Thanks.
Yeah. So we all really care, and people like me and everybody else in the room, you'll have kind of devoted your career really to trying to make a difference. And I'm just an ordinary guy that's tried to make a difference, really. And I've been really fortunate to work in the field of kind of sport, leisure, physical activity the whole of my career. I'm in my kind of mid-50s now, and I started out as a PE teacher, went into sports development, as James said before, done a bit of work with governing bodies in sports development, bit of community stroke sports development, and then the last kind of 14 years in leisure, and I've managed a few leisure companies. The current one, I'm kind of 2.5/3 years in. It's a local authority trading company, and this is probably going to be my last kind of role at this level. And I wanted to really make a difference and mobilize all my learning that I'd accrued in the kind of previous 30 years of my career. And I decided actually this wasn't about leisure. This was about health and well-being. So when we set Brimhams up, we incorporated it as a health and well-being company, not a leisure company. And I was privileged to be appointed by Harrogate Borough Council at the time to set this company up. And their vision was very clear that they wanted their leisure assets to have an impact on community health and well-being. And actually physical activity was just the core element to that, but it was more about creating a wider holistic health and well-being model. So that's what we've endeavoured to do. It's very early days, but I can talk to you today a little bit about the why, and that'll build on what Kenny said. I'm going to talk a little bit about what we're doing, and I'll take some questions during the latter part of today's session around how we're getting on. I'm sure people will ask me that. And I'll share some conclusions at the end of my presentation. So just to start us off, a little bit about the why. And I love this statement: be brutally honest about the short term and optimistic and confident about the long term. So James shared some really interesting stats with us at the start, about where we are really in terms of our UK economy. And it's a little bit scary, to be honest, about where we are. We seem to be declining in economically compared with our other similar neighbours in Europe. If you look at our health statistics, they're quite poor in terms of inactivity levels and poor health. We've got about 5 million people dropped out of the workforce since COVID, so we're less economically active. We've got 2.5 million people on long-term sick, seems to be on the news at least 3 or 4 times a week these days, and how we need to get more people back in work. And let's not forget the profound effect that must be having on people's mental as well as physical health. And a prevailing statistic, which has been around for a long, long time, and I think Stu Stokes is from Refer All is in the audience today, and he will know this one, is that 80%, on average, about 80% of GP visits are avoidable. They're due to lifestyle disease, which is shocking when you think about the demands on the health and social care system. And in fact, we could avoid and reduce a lot of those demands significantly. And people are generally feeling poorer, and the council demands on the council's budget are enormous, and almost 2/3 of those now are spent on health and social care. So for discretionary services like leisure, the future doesn't bode well. So how can we be optimistic? Well, based on everything I've just said, leisure can actually present a real solution to reducing demands on the health and social care system and reducing those avoidable costs significantly. And Kenny's just presented the great work of ukactive about how they're trying to position the sector to do just that. So the challenge for us is to try and deliver more and better outcomes for less. That's the game that we're in. There's no new money out there because you've seen the statistics. This is about spending public sector money better. And what we've chosen to do at Brimhams, with the support of our council client, is say, how can we better use the leisure assets to try and prevent some of those avoidable costs and demands on the public sector system? How can we do that? And what we've said is we're not about physical activity. We're not about leisure. We're about health and well-being. And we've been really clear about that. One of the next stages, and something that we've not quite cracked locally and definitely nationally, in my view, is this ability to genuinely pool resources across the system so that we can use existing resources better and pool them around the common objectives of the various national agencies and stakeholders. So locally, the NHS, the VCS, voluntary sector, leisure, and other providers that are trying to deliver the same things. How can we come together and genuinely collaborate and pool our resources to get economy of scale and economy of effort? And I think that's a real opportunity going forward, and it takes really strong, deep local partnerships to do that. So the other point I wanted to mention in terms of the why in Brimhams Active, absolutely Brimhams Active needs to deliver its commercial objectives, because we've got swimming pools to run, and they cost money, and we need to develop a return in terms of our gym and fitness exercise provision. So yes, we're chasing that conventional 15% of the marketplace, but we want to go to that 20% that Kenny talked about before and beyond. And our real focus is about tackling inequality, because if we really want to turn the curve and be really seen as impactful in terms of reducing those costs to health and social care, it's reaching out to those people that really need us. And arguably the commercial sector is not going to do that its first port of call, because it's not commercially viable. You know, the inputs you have to put in order to reach out and deliver the right types of services and support to address inequalities do require a level of subsidy. So we produced a strategy called Revitalise and Reinvent. Revitalise was about capital investment, and we recognised that in order to deliver a great service, we needed to refurbish and revitalise our leisure facilities. So we had 50 million that went in to do that across, built 2 new sites and 1 major refurbishment of our 10 facilities. And Reinvent refers to reinventing the service model from a conventional leisure service model to a more holistic health and wellbeing focused service model. It's there to try and combat lifestyle disease, to try and increase that healthy lifespan. And if you're like me, you'll have got to an age where you're suffering those aches and pains and things like that. So at one time, physical activity for me was in the sports performance context. Now it's about me maintaining good joint health and also good mental health with the stresses and strains of work and everything else. And that's why it's really important for me. So our strategy is fairly succinct. It goes into several pages, and this summarizes it on 1 page, and this is available on the links that will be shared and on our website, Brimhams Active, if you want to have a look. It's got 4 key themes to it. The 2 on the left are customer focused, and the 2 on the right are internally focused within our organization. We want to take people on a journey to make a start, to stay and succeed in their physical activity endeavors, to promote good health. And we're very much a people-focused organization, because it's the people that deliver our offer. So how do we enable and embed and excel our service offer? That's through having great leadership, values-based leadership, and skilled practitioners. What we also do is take our performance management very seriously, and that's very much about not just about outputs, but it's about outcomes and seeing the difference we're making to people's lives. And obviously that plays into the debate about the sector. We've got to provide more evidence in order to justify that repositioning of resources and getting our share of the limited pool of the resources to do more and better outcomes for less. Just to kind of bring that to life a little bit in terms of the customer, for us, it's about how we reach out to new populations so that they can cross the threshold into what might be seen as a little bit of an institution, the world of leisure. And we do have community wellbeing hubs as well as our conventional leisure facilities, and some of those are positioned in the most deprived wards of the geographic footprint of where we operate. And they will provide a range of specialist services to support people on their health and wellbeing journey. It's about putting effort into authentic partnerships, and particularly this is a challenge for operators, as operators are trying to operate with diminishing resources. How do you get the management capacity to do that reach out work? But we've got an arm of the business. We've got a business development arm as well as an operations arm, and we've invested in that because we know we need people to cultivate and manage those partnership and leverage resources into the organisation. We're trying to offer as many referral pathways into services as possible. So that can be through a clinical route, GPs, but also self-referral and peer referral. And we're trying to make that compelling and straightforward so that people that wouldn't normally access us can do. And we use a lot of software solutions to do that, which are all under development. In terms of the actual experience, the high quality facilities and investment is key, and Alliance Leisure have led most of our developments, and that partnership's been really key to maximise value through the supply chain to create affordable, high quality facilities, which has been fantastic. But it's the offer that you deliver, and I'm going to talk briefly in a second about our 5 ways to wellness service model, which defines really Brimhams Active and our health and wellbeing approach. The focus on health condition management is key, and particularly that's where we really do hit the inequalities. And more people are suffering long-term health conditions with an aging population, which is why it's great to see the connection between what we're doing and what ukactive are trying to do at the national level. So it's where national meets local to make this work. And we've invested a lot in group exercise as well, which allows us to reach a much wider demographic from cradle right through to the much older population with a wide variety. And we've made a deliberate business decision to invest more in group exercise, which is costly, in order to reach more people and retain more people. I've talked a little bit about our people development, which is absolutely key. And Andy's going to talk later. And I know Andy's been the architect of kind of systems leadership. And we've done a lot of work on the softer skills with our leadership team in terms of how we understand ourselves before we can understand others, which is really important in terms of coaching your people and team and having a coaching style of leadership, which we also think is really important in terms of communication with our customers, but also our leaders and how they work in partnership with others and how they understand where we fit as a system partner and provider, which is providing services to reduce demands on the health and social care system. You know, and the development and leadership training that Andy's developed with John Oxley in Future Fit is second to none, and is really important aspect of that work. In terms of finance and performance, I've talked about the importance of outcomes over outputs, and our focus is very much about retention and not sales. So we're looking at length of stay, we're looking at customer sentiments, and really trying to refine that customer experience so we can extend the length of stay as long as possible. What we want is people to see their direct debit with us as a lifetime commitment. And we want to meet people where they are to meet their specific health and well-being needs over their life course. And we have wellness coaches that are charged with doing that and supporting people at a personalised level. But to scale that in a sustainable way is difficult, and that's a challenge we're trying to deal with at the moment and work out how we best do that. We were the first organisation to get water wellbeing from Swim England across all our pool sites, which is a real rubber stamp to say we operate inclusive swimming pools. And swimming is just as, if not equally or more important than our dry side offer, certainly for supporting those people with long-term health conditions. And we're pursuing Quest with a degree of vigour across all our sites after being operational for a couple of years. Just in terms of our model, and this is the kind of fundamental model really to our strategy, and we've stolen this unashamedly from the NHS and their 5 ways to wellbeing, and translated that into something that means something for us as an organisation, and that we can project outwardly to our stakeholders as well, to demonstrate that we're not just about physical activity. Actually, we're about helping people connect with their communities, because that's really important, not only to adhere to a better lifestyle, but also to combat things like loneliness, and really important for your mental health. You know, leisure environments, community wellbeing hubs, they provide a real space for connection. So it's how we actually identify that as an output and an outcome within our business and measure that. Mindset, we all know physical activity instantly improves mental health, but how can we extend that more with how we support people through motivational interviewing, through talking therapies, and how we can introduce that so people can come through the leisure centre door, and when they have those difficult times in their life, actually there's someone for them to speak to there and they don't have to go to the GP. And we do have various tools, including an app that will can measure and identify where people are in terms of their mindset, and if they have got severe issues, it will signpost them through to a clinical pathway. So that's really important for us too. Nutritional advice and guidance, and my favourite, which is recovery and rehab, simply because I've got so many aches and pains, knees and back and stuff like that. And I've had so many suboptimal experiences myself trying to engage with the NHS to resolve certain MSK conditions, when actually the solution was probably within my control if I had some basic advice on basic exercises that I could do to help me rehabilitate myself. And how can we offer that more easily and readily, affordably and quickly within the leisure environment? And I think we can. And again, that's something I know that Kenny is very passionate about, and he's progressing and supporting us with ukactive's work. This won't be dissimilar to what a lot of progressive leisure operators are doing around the country, but this really is just a flag to say, look, we're really into supporting people with long-term health conditions, and these are the areas that we're into. And we've got we invest considerably in this offer. We don't have funding to do this. This is self-sustaining, and we're looking to continue to do that. Just in terms of how we deliver the service, we don't have fitness coaches, we have wellness coaches. And I went out to the market to try and find a professional development program so that we could create the modern, the contemporary wellness coach. The market couldn't provide it for us, so we created our own pathway. And someone in my team, Joe Bogan, created this pathway at various levels. And this is the introductory level, the level 2. And we do go up to level 4, level 5. And we pieced together this professional development program. It's early days for us, but you can see from the components of that we're equipping people at the nutritional level, at the mental health level, at the physical activity level, and the ability to be able to have those coaching style conversations with customers. We want everybody to have a personal conversation, and our induction is an hour-long welcome to wellness induction when people first come in to see us. We take measurements, we have the conversation, and we provide a bespoke program to meet everyone's personal health and wellbeing needs. Just some conclusions to draw, and this is wider conclusions, not just Brimhams Active. We know we've got an existential problem, and public leisure has got a vast amount of assets and people assets, brilliant people, brilliant facilities, a lot of which are lacking investment, but we can be part of the solution with that investment. And if we are invested in, we can reduce those costs to the health and social care system significantly. That will reduce that investment. I personally think we need a long-term strategic approach and vision. ukactive have got the 2030 vision. I'd love to see a 2050 vision, which is not about physical activity, which is about redefining the public leisure centre to be about health and well-being, not physical activity. This is about health and well-being. Physical activity is just the tool. We can do much more, and that will position us better to be part of the solution and receive the investment we need. It's complex. We need cross-party political support to enable long-term planning and delivery, not just at the national level, at the local level, and that's why we need to join up as a sector. And the sector can be quite disparate with the different models, private models, charitable models, trading models, in-house, but it's how we break down those barriers and come together as one unified force that's really important. It's about spending the existing money we've got better, not chasing new money. There isn't any. The private sector's got a role here, and although we're non-for-profit, we have a whole supply chain of private commercial providers that support us to deliver the service at the front line. And those are really important, those partnerships. We need professional credentials for the service. There was a great piece in Health Club magazine this time round. Duncan Wood-Allen, Andy, and a few other expert contributors to that. It's really identifying the gap in professional development at the leadership and the practitioner level. There's been good moves in this direction, but if we want to be seen as a professional workforce, we need the professional credentials, skills and competency. So that's a big opportunity for us. We need, it's transformation across the board, really. Brimhams, we've done a lot of good work. I'm really proud of the team for the work we've done. We're not on our own. There's lots of really good examples around the country. And I think it's about talking up the good examples. They don't get enough airtime rather than where the bad examples are. We can be a great team if we work together. So I'm going to hand over to my good friend and esteemed colleague, Andy King now.
Andy, sorry, just you don't mind me interject there. Mark, as I said, very humble. You are definitely not an ordinary guy. And I love the lifelong learning and mobilising the learning. So I'm just urging anybody who's attending the webinar to note that you have a Q&A functionality in the chat alongside here. If you have any questions that you want any of the panellists to answer later when Andy has run through his insightful information as well, please drop them in the Q&A so that we can pick those up accordingly. Andy, please fire away. Looking forward to it.
Thanks, James. Apologies, everyone. I've got a bit of a sore throat, so hopefully I won't cough and splutter too much through this. And I know Mark actually has got COVID, in fact. So well done, Mark, on getting through that rather well. Nobody would have known. Apart from that, I just told everybody. And two inspirational talks, and I'm just picking up that last bit from Mark. Really, one of the things I think we will, and I'll touch on it later, and there's actually a poll on this, I think collaborating and recognising increasingly the work that's going on in this sort of space, in working with, whether you call it pivot to active wellbeing or health, is so important. So anybody watching that's thinking, we're doing loads of good stuff, let us know. Please get in touch, because we're going to shine a light going forward on these good examples. So, you know, we get the opportunity, I get the opportunity to represent GM Active quite a bit, to be honest, and some more coming up. And that's great, and that's wonderful. But we don't want it to be about an ego thing. It's about encouraging others to share what they're doing, no matter how small. Ideally, it's been evaluated. You've got some measures of impact. And then we really want to help you shine a light on that and come together as a sector to really highlight what we can do. Anyway, so I'm the chair of GM Active, Mandy King. I'm also a director with Miova nowadays, which is very much about helping organisations, councils, etc., work on a whole systems, place-based approach, look at the pivot to active wellbeing, and help you get started. If you're not quite sure how to get started, then we're there, set up to do exactly that in a number of different ways. And we're also executive coaches as well, using the strengths model. So that's my plug for Miova. So just in terms of bit of a faux pas on the slide there, by the looks. Just in terms of context, before I talk to you about the latest on the GM Active update and the Pivot to Active Wellbeing funded project that we got some funding from Sport England and GM, just the context of what's currently just about to happen or beginning to happen, which you may or may not know. So just very, very briefly, Sport England, on the back of their local pilots, local delivery pilots, 12 of those, going for a number of years, they've taken the learnings for all that. They've decided that the outcomes of that investment so far warrants them really sort of putting £250 million into similar programs and initiatives in between 80 and 100 places. So they're going to invest £250 million over the next few years, mostly revenue, some capital. It won't be a prescriptive, this is what the money's for. It will be based on the needs of a place, or with the aim of getting more people physically active, linked to health, and decreasing inequalities as best they can. 35 million approximately go to existing local delivery pilots to what they call deepen the work. So if you're in one of those places, it's worthwhile making that connection with your active partnership. It's a phased approach. There's 15 approximately places being funded currently, and another 15 later on this year. That's the plan, as I understand it. And one thing they will all get is the introduction to systems leadership. So I'm going to touch on that shortly. And the aim of the investments, I say, is to bring various agencies together in a place. So this isn't about money just for our sector, far from it. It's about creating a collaborative approach in a place, and you can define the place, come on to that some other time maybe, but it's a small place with a significant amount of money to bring people together. And what they're trying to do is move the dial on physical activity, as I say, and actually improve individuals' health and population health in general in that place. They want to see resources, as I say, aimed at those people who need their support most, a thing called proportionate universalism. So this approach will go into a place for everybody, but the resources will be aimed at people who are, we have used the term in the past, hard to reach, and who need the support more than anybody else. They don't want it very much to be a top-down approach. It's all about community engagement, properly deployed, and getting people to figure out themselves what they need to do. What are their barriers? How might they overcome those? So that's quite a significant investment, as you can understand. And what they're trying to do then, to answer the question, why don't people move more? And they look at this as a challenge, which is a complex issue, and not simple and not complicated. So by way of explanation, you can see it there. A simple challenge, a simple problem is X causes Y, like a recipe. If you follow these steps, you'll get a predetermined outcome, he says, being the worst cook in the world. But anyway, take my point. Equally, a complicated problem, which you might say, yeah, it's a complicated problem getting more people physically active. Well, actually, it's not, because a complicated problem like sending a rocket to the moon or a local authority emptying the bins and all the rest of it. Yes, it's complicated, but it's been done enough times to follow a process, trust the process, as they say, and X causes Y, and you can actually achieve an outcome more or less, guaranteed. A complex problem, the best example there is raising a child. We all think we know how to raise children until we actually try and do it, and then figure out that even with the best will in the world, things don't quite go to plan as much as we always like. And the approach here is to say that actually getting people more physically active actually is a complex problem, and we have to understand that. We'll ignore chaotic for the time being. That's for another day. So in terms of taking a whole system approach, recognizing that it's a complex issue, and the complexity comes around in a number of forms. And if you take a whole system approach, this is just a real snapshot, you can see there some of the factors that go into a whole system. So, for instance, cultural norms and ideologies. And my colleague at Miova, Ken, always poses the question about any dog walkers in the audience, and people put their hands up and they say, okay, how often do you know you have to walk your dog? Oh, every single day, maybe twice a day. Okay, how many of you have also got children? Put your hands up. Right, how many times do you need to walk them every single day? And it's like, oh, that's a good point. We don't do that. So there are things pushing and pulling against us, cultural norms and ideologies that we have to try and recognise and understand in order to try and address this challenge. Equally, what policy, the classic no ball games on this grass and things like that. There are things that are stacked against people doing physical activity and taking part in activities. What's the physical environment like? Is it conducive to people getting out and about and being more active? What about the organisations and institutions, the social environment? Before you even get down to the individual, and one of the questions we ask in the workshops and let people have a good old debate about this is, if somebody's inactive in Workington, say, 35-year-old lady in Workington, maybe pre-diabetes, and she still doesn't get active, whose fault is that? Discuss. So maybe you want to think about that. And you can't ignore the politics and all this, by the way. You just can't. But it's a good one to debate down the pub, if nothing else. So that's the whole system approach. So why is it so difficult to change systems? Again, we use various different diagrams and pictures to illustrate this, and it's quite illuminating, really. The complex reality is, you can see all the roots. We try and deal with the top of the tree, taking our linear approach, try and fix something, and we've got to be honest with ourselves here. Confront the brutal facts. We're not making much headway, guys. The population is still very unhealthy in all sorts of ways. My pet hate is children going to school and come out fatter and more unfit by the time they come out at 11 years old, before they go into secondary school. We've designed that system. The system is perfectly designed for the outcomes we achieve. We have to change the system. In order to change the system, you've got to understand why it's so difficult and all the things that you need to be able to do in order to achieve that. So systems thinking, taking a whole systems approach, is trying to get us to say, look, the systems thinking, we have to take this challenge in the round, and a holistic approach. You need to take time. You need to seek to understand before we start getting our hammer out and bashing our little solution. The systems thinking on the top there is understand the system. And in our transformational leadership program that we do in GM and elsewhere, increasingly, we take time to get our general managers, for instance, to actually map the system that we are part of in a place, whether we know it or not, and then understand the leverage points. Who are the people? How do we actually make a difference? Who do we contact to help us and to collaborate with to actually start to move the dial on a local level? This is all about the linear, non-linear approaches. And if you take the wrong approach, if you take a linear approach to a problem, you are in danger of making the problem worse. You certainly won't solve it, because you'll constantly be going around in circles, just doing the same old thing. And if that sounds familiar, that's why we've got to learn from this approach. There's enough evidence out there. Organisations such as, top of the list, the NHS, have set up whole loads of training programs in this for the NHS staff and managers and directors, because they realise that they need to change their way of thinking and systems. It's easy to say, and I say it's complex, it's difficult to do. But when people like that and organisations like that are saying this is a way to go forward, we need to be doing this. That has implications. So if we are saying that we are going to pivot, whether you like the word or not, and our aspiration is to work more with health, then we need to understand, well, we need to understand more about them. We need to understand more about the challenges and the needs. But we also need to look at ourselves and say, what's our leadership got to be like, the style of leadership, in order to not just manage and lead my organisation, but to be part of a collaboration of organisations. Because whatever we think, we cannot do this on our own. And this is the place-based approach philosophy really underpins the whole thing. We need to be part of a system approach in a place, and therefore we've got to have different qualities, if you like, and you can read some of them there. The top one, you're going from creating traditional management structures, and you're taking the time to build relationships, networks, and trust around a shared purpose. I mean, just that alone, build relationships, take the time. You know, do we give our managers time to actually go out there and build relationships and network? I don't know. Do we? Do we trust them to do that? Do we build trust? Do we actually take time to listen and build trust? Do we know how to build trust with other organisations such as health, who probably think you guys are just here because you're a bit strapped for cash yourself and you're trying to get some money out of the health system? We have to be better than that. And the key thing is a shared purpose. I'm coming on to that shortly. So GM-Active, we move as one. So GM-Active is a collaboration of 12 operators of all different varieties. I've said there. I think there's a poll going to pop up any second now. And this is important because the 12 operators, we've got everything from in-house operators, and it does change. It changes all the time. In-house operators to national chains, LATCOs, CICs, you name it, we've got it. It doesn't matter to us. And, you know, maybe it shouldn't matter so much to other people as well. We all have preferences. You know, I'd love everybody to be a charitable trust personally, and I think most of us would. But it's not in our gift. So again, one of the things with systems leadership is you start to really think about, well, if it's out of my control, I can have an opinion on it, but let's deal with what we've got and actually make some headway on that. So hence the poll question that's coming up. So we've got a shared common purpose. When you think about this, 12 organisations across 10 councils, there's so many aims and strategies and all the rest of it. We've narrowed this down over the years to say this is what we're all about. Nothing more, nothing less. So just coming out of the pandemic, we actually managed to get some money from Sport England and each of the 10 authorities which are listed there. And we enlisted the help of Duncan Wood-Allen, who I think is on the call. I know he is. And SLC, who've been absolutely fantastic, to be honest. And we've been working on this project now of the Pivot to Active Wellbeing project across GM, which I think the very latest results, if you like, will be at the GM Moving Conference, which you can sign on to. It's 25th of March, and probably Elevate and stuff will be showing more detailed work on this. And this includes things such as potential designs and principles behind designs of what actually a leisure centre transforming itself into a community hub, community wellbeing hub. What does it look like? What could the financials be? What could the revenue implications be, etc.? So a lot more detail that's gone into that, and I'll come on to that in a minute. Excuse me. So the three work streams that we had for the project were about physical assets and repurposing, the pivot to wellness, where we worked with academic partners, and we are working with academic partners to look at various other programs, and the federal approach, which is basically where we could share resources, keep a local approach, but potentially share back of house resources and be even more efficient by working collaboratively together. And even things like utilities procurement and all the rest of it, and sharing that sort of information. So looking first and foremost with our assets, we've got, I think we've got a few less than 99 now because a few have closed recently, never mind. So we've got approximately 100 assets, if you like, facilities, and an army of, I think we've got more staff actually, 3,600 staff now across Greater Manchester. And our aim a few years ago was to actually transform this workforce into being an army that can actually work on the increasing the population health and improving population health and decreasing inequalities. And right at the bottom there, I've said that we've got a proven track record to success, the Prehab for Cancer, which I won't go into too much today, but it's a great example that we would put forward and say, here you go, here's one program that's been co-created. It's got recurrent commissioning funding from the NHS. It's serving 1,500 to 1,600 patients a year at the moment from 1,000, and crucially, the evaluation of that has shown that it works both for the patients. They get out of bed about 1.5 days earlier than those who don't do the program. And this is not us saying this. This is the NHS have evaluated this program, and they save between £400 and £500 a person as a result. The NHS do. So therefore, it's a no-brainer, and they're funding it, and they have an aspiration now to work with us to grow that to between 10 and 20,000 patients a year across GM, and to do things other than just cancer. So, you know, a fantastic track record there. And that's what the type of thing that we're looking to do. So in terms of the assets, the buildings themselves, there's a great diagram here. There's a lot more, as I say, to come very, very shortly, coming out from us and from SLC and the team. But effectively, we're saying, as Mark was talking about, some of the services that we see, the vision, if you like, for the future is, you know, and I quote Sarah Watts here from Alliance. Sarah said recently that, I think in an article in HCM, that she doesn't think she'll ever build another leisure centre. They will be wellbeing centres, wellness hubs, call them what you want. I think there's still work to be done to say, where is this happening already in part? And there are some great examples, Warrington, Crewe, elsewhere. Abercroft Leisure with Warren are doing some great stuff. And we know there are pockets of this stuff happening. MSK Hubs with ukactive, MSK Hubs, some of the work in GLL in Cumbria, for instance, and elsewhere. Some great stuff, but you got to look really hard to find it. So we're gonna do some work about that. But effectively, we want to look. Well, this is some of the work that's been going on. So say to look at this, to getting rid of the leisure centres and saying, what does it actually mean to create these wellbeing hubs? So look out for some more information coming out on that shortly. And it's been mentioned already, but the workforce, we started the GM Active Academy a few years ago, mainly because we could see what was coming down the line with prehab. We anticipated being in the situation we're now facing, where it's very successful, and we need appropriately qualified staff in order to expand. And it's potentially on our risk register, it's number one, that we won't have the right staff. So working with our colleagues in GM and working with SIMSPA, we're seeing what we can do with the local skills board to actually do something about that. But what we've also done is say, look, we need all of our staff, the 3,500 staff that we've got, to be more aware of what we're doing and actually what is their role to play. So, for instance, all of our staff are constantly doing the MEC, the Making Every Contact Count training that we've got, and a whole host of stuff now that we've got on a digital platform with FutureFit, which is available for everybody. And Mark said earlier about the stuff that Brimhams have done. It's very, very similar. And I think the next thing to do is, again, to capture the work that I no doubt some of you listening are already doing in this space and saying, right, how can we actually build that so it's a lot easier for everybody and we can speed up this pace of change, if you like, and to go through that. So there's a load of things that we're doing. I can share more detail and put you in touch with FutureFit if that's of interest to anybody on that side. A big part of it, again, it's been mentioned. There's a picture of Andy Burnham there because Andy Burnham's a great believer in what we're doing, mainly through initially Prehab for Cancer, but then he came along and gave out the first gongs to our, now we've got 80 graduates of the Transformational Leadership Programme, but the first 20 got their gongs off Andy. And we got a little bit of local pilot funding for this. And this has definitely influenced some of the work that I've said at the start that Sport England are looking to roll out. And we've got this now available again through Future Fit, available for people to actually do this. And we're now working on the level below our general managers, so people at the aspiring managers, so that sort of level 3. And again, that workforce program is so important. And SIMSPA are working with us on this. There's other stuff going on here that we have the support of SIMSPA very much to actually build this and make this available for anybody who wants it, basically in whatever suits you, designed at place level. So again, if you want some more information on any of that, workforce, give us a shout. And lastly, the other bit we're doing, and I won't go into too much detail, but basically the Active Academic Partnership is the last bit of funding that we got. We've partnered with some university colleagues to actually look at almost finding the next prehab for cancer, really. And what they're doing here, there's a poll hopefully on this, as I've alluded to, is they're looking across GM at the programs that we've got for all the different long-term conditions that Mark put up a long list there. We've got all those things going on. And just as an example, I was out in, lucky enough to be in the PAF conference in Switzerland a couple of weeks ago. And I got talking to Duncan from down south. And he said to me, he said, "Oh, I heard about your prehab for cancer. I'd like to talk to you, but it's not about cancer, actually. It's about falls prevention." I said, "We don't need to talk to me about prehab to talk about falls, because we've got some great work going on in falls prevention in GM. I'll put you in touch with the right people." And it just underlined the fact that why haven't we got a directory of what everybody's doing, and not just everything and anything, but stuff that's been evaluated, that's been proven. Ideally, it's been commissioned, but not necessarily. So let's create something is our suggestion. And I know Kenny's very supportive of this. So hopefully something will come out soon to encourage people to share what they're doing, and we can then make it much easier both for ourselves to not have to reinvent the wheel all the time, but also for health partners or potential partners to look at us and go, "Oh, blimey, look at all these long-term conditions. And this is the stuff that's already going on from this so-called leisure sector. Maybe we should give them a bit more airtime and see what else they can do for us." So in summary, this is again something that was produced by SLC for our colleagues in Bury. This is the type of thing, we see this as a network. Sport England see this as a place-based approach, a whole system approach, where we're very much embedded to the local community. We're not just selling memberships and swimming lessons. Yes, we do that. And another question that I could have gone on about was how the two are not mutually exclusive. A great friend of mine, Chris Rushton, proved that when he was at Tameside. He's proven it again in Blackpool, and others I'm sure doing the same, where you can actually marry these two objectives, that the social objectives, the improving population health and being commercially brilliant. There are great examples out there where that's happening, so we can learn from that. So thank you very much, and I'll hand back, I think, to James.
Thanks very much, Andy. I'm just going to try and take the presentation off the screen here, if you can bear with me a second. Gents, if I could ask you to put your screens back on, that would be appreciated. And I'm sure everybody who's on the webinar would agree that was incredibly insightful across the three presentations there. I've got a new term that I've learnt today, Mark, about mobilising learning. There's clearly so much to take away. And Andy, what you've just said about having that, as I would term it, a toolkit with an evidence base against it of great practice, but not just great practice and showing what it is, actually great practice and showing people how to get there. I think that's the important bit, which is the nuts and bolts of the toolkit there. And from an Alliance perspective, I'm obviously delighted to be part of the narrative, sitting with Kenny's colleagues on UK Active with the Decade of Change work stream. I can see some synergies from conversations that have been raised here today. But yeah, I'm really enthused about where we can go. Been in this industry too long, as a lot of us have on the panel here, and I'm sure on the webinar, but I'm sure we're all still passionate and want to make that difference. I'm going to kick off with a question that somebody actually gave me yesterday, and it's something that I've actually asked before in a number of forums, and it is, what does life look like if the public sector isn't here delivering leisure, health, well-being as we know it, and as we think the impact it can make? So if we took public sector out of the equation, is that catastrophic? Will the private sector pick it up? will the NHS take the mantle, or is there just going to be a big chasm? I think I know what my answer is, but if I can throw that out there to each of you, if you've got any thoughts around that.
Yeah, I'll jump in, James. I think it's a great question, and funny enough, when I was chief exec of your trust in Rochdale just before the pandemic, and we actually were trying to sort of refresh our strategy and whatnot, and we actually posed a question: what if we didn't exist? And then lo and behold, the pandemic happened, and we didn't exist. We were closed, and people really missed us. So it was quite an eye-opening lesson, and we should really recall those days when we were closed and the approach it took. But apart from that, I'm one who says that if we didn't exist at the moment, public sector leisure, we would be invented. We would be invented not in the way that we are now. This is why it's a pivot. This is why we would be reinventing ourselves, if you like, or we're trying to reinvent ourselves. So I think it's really important to say we have no divine right to expect to be funded and here forever, because it might be the private sector just takes. If we do not do this, if we do not prove our worth by pivoting, or whatever terminology you want to call it, and actually be proven to be part of the solution or solutions, because we can also talk about antisocial behaviour and all sorts of other things that our service does already contribute to, but we've got to be better at it. We've got to do it more at scale. And if we do that, the future's bright. I genuinely believe that. If we don't, I think the private sector probably will take over in some places. And unfortunately, the people that we're talking about who need our support most, who need to address their health conditions most, we will be the ones left behind, undoubtedly. So we've got to get off the fence, if you like, and say this is our proposition, this is our purpose, and then act like it and act as one, as we say. That's my point.
Yeah. No, I love that, Andy. I suppose if you go back in history in that first centre in 1882, whatever it was on the slides earlier, I should know that than being my slides. But we have been invented at a point in time and reinvented, and I think we're clearly all saying the same thing, aren't we? It's an opportunity to reinvent ourselves for the next generation. We've got an opportunity to make a difference before we bow out, I suppose, here, but it is very much about what that next generation. Mark, do you have any thoughts to add on that one?
I do, James, thanks, and hopefully follow quite neatly on from Andy's key points there, particularly purpose, really. I think my view is at the moment, I mean, it's a great question, and my view at the moment is we haven't really got a clear vision for public leisure, which is defining what we're about and what our purpose is. And when we haven't got a clear vision, that leaves us in a bit of a vulnerable position, because we are drifting and at the mercy of the resources available in the public sector, and it becomes extremely discretionary and subjective about whether we're invested in or not. So we need a clear purpose, like Andy said, and that's been the common thread of Andy's and mine and Kenny's presentation today and your introduction, James. We need a common purpose, and now is the time to define that. And I've been clear what I think the purpose is. It's about health. It's not about physical activity. Leisure is not going to solve the national inactivity crisis, but what it can do is it can be very specific about what it can do to turn the dial in communities that need it around their health and well-being, using physical activity as a core tool. It can provide a hub and spoke model. Now, the question is, if that wasn't an investable proposition, where would the private sector choose to invest? And the key to that is choice. The private sector would make a choice where to invest. They would not invest universally across the country. They would choose where to invest to get a return on that investment. And that is absolutely right and proper, and what you would expect from the private sector. The role of the public sector is to fill in the gaps where the private sector don't choose to invest. That is the role of the public sector. And ultimately, that comes down to addressing inequality. And for anyone that's done any reading or research on inequality, you will know that the best way to create a vibrant, dynamic economy is to level up, is to focus resources where there are inequalities. Leisure can do that. Our role is about improving health in those areas that really need us, where the private sector won't go because it requires investment but it also requires us to be efficient and effective in terms of the outcomes we deliver, but also to prove that level of efficiency, like Andy talked about. There are operators out there that can be effective and efficient. Just because you're there to address inequalities and just because you're there to fill a gap for the private sector is no excuse for being inefficient. So, that's what's got me out of bed every day for the last 30 years, to drive an efficient and effective model. So I think there'd be major issues if it's left to the private sector. There'll be gaps. And I think there's an opportunity for us to fill those gaps and use resources that are out there better in an efficient and effective way. Great question. Thank you.
No, and a great answer there, Mark. Makes perfect sense. And it's all part of the ecosystem, isn't it, of understanding where each, sector, where each organisation plays its role in that. But I'm passionate. I only work in public sector leisure. So if I thought the answer was it didn't exist for the future, I'd probably, sit on the sofa for the next 20 years, seeing out my career. But I'm really passionate about that. Kenny, specifically on that one, I know ukactive, you play a role where you do represent private and public sector, but specifically on that question about public sector, have you any observations?
Yeah, what those pioneers said, really. But to complement that, I think there is a movement for healthcare to come out into the community. It doesn't make sense financially, long term, for the NHS estate to create rehab spaces within there. It's not viable. So that would be that's where we would pick that up. Public leisure and private, but I think there's not enough physiotherapists out there. I am one. There's not enough, by background. There's not enough physiotherapists and occupational therapists out there to deal with the long-term conditions that need to be addressed. And the waiting list is currently 7 million. So for some of that a lot of that is MSK actually, but multimorbidity, let's just say. So there is a huge need. So it would be reinvented, like Andy and Mark said.
Thanks, Kenny. And one of the things when coming to you there, Kenny, about this challenge of I'm just looking at my notes, I've made engaging 20% by 2030 and tying up with Department of Health and Social Care, Department of Work and Pension. And I probably would say in that, it's always quite bereft when we have these conversations where the DCMS sits, and you would have naturally thought that the DCMS is one of those pivotal organisations alongside, and it sometimes doesn't appear as tied up as that. But one of the questions in the chat, and it crosses over with what Mark, you mentioned earlier about the level 2 training in your pathway. But Kenny, you mentioned about the primary care networks and the 12 new roles, which crosses over to what Mark was saying about the role of a wellbeing assistant per se, rather than a leisure and rec attendant as we were growing up. Who's the gatekeeper for having those conversations, Kenny? Is it changeable on a local level, or is there a specific route to unlocking those conversations around where leisure public sector can play a part?
Good question. It's not easy. Now, Mark and Andy are probably doing this at the moment. They're involved in the RS program probably, but if you guys are, interject. But it's relatively new to me in the last 6 to 8 months about this RS, and this unfortunate acronym RS, that there are roles in the community that can be reimbursed, and the gatekeeper is the ICS in the primary care, within that primary care network. So as I said, there's one of our operators on the South Coast who have roles that are being funded within their spaces by this RS role, and that's a great way of us integrating into healthcare. But I think the guys, I'm not sure, are you guys involved in RS, Mark? Andy?
No, funnily enough, Kenny, Sarah Lydon, who's the health lead in Manchester Active, it's her personal mission to see our health coaches, wellbeing coaches on that list in Manchester. They're not at the moment. So we're fully aware of it, and Sarah's fully aware of it, trying to get us on there. And she's quite hopeful that she will, but at the moment, no. So we're aware of it. It's a mission to get on it, but we're not on it.
Okay.
Likewise.
Okay. So what I could do is find out if they'd be happy for me to share the link, the operator, to share how they got involved in it. And that might be useful to the audience.
Yeah, I absolutely would, Kenny. I think taking Andy's earlier point around the best practice, and as I tend to talk in my language, the toolkit of how you get there. There is some great practice, but wouldn't it be great to have that framework in existence? And that's
Totally.
from an asset perspective as well. There's some really good stuff that NHS Wales are putting out there of understanding their types and models of what their hubs are. So they have a type A that's a general hub that in their mind is a leisure centre with some services delivered within, to what you would call the specialist at the other end, Kenny, which is probably even more specialist than MSK, and seeing where that sits. So I think it's a bit around the services and programmes that we deliver and a toolkit for that, the facilities that are required as well as out in the community to deliver that, and having a consistency, but also having that toolkit and how we interact with people, qualifications and framework. I'm going to change tact a little bit there, because I had a great question in from Shona here. Sorry, Mark, we're not jumping off just yet. Oh, sorry, were you jumping in there?
Just very quickly, I've just been looking at the chat and seen a point from Joanne Bruce in the chat about local barriers. And I think it does link back to the question about, what would happen if we didn't have public sector leisure? Because I think one of the real opportunities here is with public sector leisure is to have very localized provision, and particularly with the Brimhams model of how we like to lead our service. It's providing those specific facilities with the autonomy to create their own program and meet the needs of their local community. And so getting the balance between having a scale operation and a locally driven and planned organization, there is difference. McDonald's, fantastic, super efficient. You get the same burger in Singapore as you do in Swansea. Brilliant. But leisure shouldn't be like that. Joanne makes a great point. It needs to be tailored locally. And that's where Andy's system leadership comes in, about having the centre managers and the facility operations staff really tuned in to local need. But we're going to lose that if we go to scale provision and don't have those local centres, and we reduce the number of centres to produce a more, what might seem economically efficient at scale model. So I think that's a great point from Joanne.
Yeah, no, absolutely, Mark. And it's some degree, sorry, Shona's put a great question in here as well, which I'm interested for your thoughts. And the question is around how important the panellists believe it is to be able to quantify and monetize the benefits of the approach we're talking about, i.e., let's call it the pivot to active wellbeing, when we've clearly got decision makers in public bodies who've got diminishing budgets. I've heard the phrase, and we've all heard it throughout our careers, do more with less. And that's a real challenge in the economic climate we have here. But the crux of it is, going back to some of the earlier discussions, we've got a really challenging financial climate, but we all want to do more. And I suppose the question is, how do we bridge that gap? Or what Shona's probably saying is, how do we influence those decision makers to understand the need to bridge that gap and invest in that as an investable proposition?
I don't mind jumping in at all. I think it's another great question, and something that we as a sector need to align ourselves to what's important to the people we're trying to work with. I think we're probably guilty in the past of measuring the impact that we think is important. And there's often been said, for every £1 spent in our services, it equates to £4. And nobody believes it, to be honest. Nobody, it doesn't make any difference to anybody. So it might make us feel better. And, I've used that with my board in the past, and they've gone, oh, that's very good. Thanks very much. Thanks for coming. That's it. There is, I'm going to use Prehab again, but Prehab is evaluated by the NHS. It works. It's a return on investment that's bankable and makes a good investment proposition. There is also increasingly, and I know Sport England have just decided to work with a company called State of Life to look at what's called the Wellbeing measure, which is the wellbeing lives, if you like, that measures, and it links across to the NHS, or the quality of life year, the QALY as they call it. And effectively, this is approved by the Treasury, approved by the Green Book. So it's coming from that place rather than our sector. It's coming from government. and saying, right, we believe in this, we've signed this off, it's in the Green Book, Treasury have approved it, and we need to be measuring, effectively, we need to be measuring what we do in that way, so our impact is important. So what we're doing then becomes more credible in terms of the difference it can make on a financial return basis. That alongside other measures that, again, we should take our lead from health or social care, if it's social care that we're trying to work with, and co-create those interventions and agree those impact measures with them and use them. No matter how difficult it is, that's what we should be doing. And then we can be taken more seriously.
Yeah, no, absolutely, Andy. And for the benefit of webinar attendees, it's something I had queued up in my emails around the Sport England impact measurement and where it's sat in social value, Andy. So I've just literally cut and paste that into the chat if anybody wants to have a look at a point when they've got the webinar for sure. And yeah, I mean, I don't know, Mark, if you have any comments. I'm sure you do have, because it's a real dichotomy, isn't it, of that balance between the two.
Yeah, I'm just going to take us from Andy and the high-level strategy policy stuff right down to the coalface again. So just in terms of practical examples, and I would say more and better outcomes for less, and I would put that word outcomes in, because quite often we can't do more of the same for the less. That's not what we're saying. That's not what we're saying. It's kind of prioritize what you're doing, focus on where you can make the biggest difference and put your investment into that to get more outcomes for less. And a lot of that is where the system joins up. So an example of that locally would be, and it's been on the news this morning, about the cost of respite provision for people and families that are caring for people with disabilities and additional needs. And the cost of respite is escalating for local councils. It's becoming unaffordable. So these services are at risk of being withdrawn and having a real impact, not just on the person with disabilities or additional needs, but on the families and carers, because there is no respite provision. So a decade ago, colleagues that I work with at Active Tameside pioneered a service called Everybody Can. And that reduced the cost of respite for people in the Tameside community by half and delivered more opportunities for respite at the same time to the council. So this is an example of more and better outcomes for less. It was evidence-based, it was researched, and the actual opportunity there is to use our downtimes in leisure centres, the quiet times Monday and Fridays, to bring these people in and provide a service and provide respite for their carers. It's something which is scalable. We should be doing it. It's a failing of the system why this hasn't been scaled to date. It's not been for the want of trying, but this is just one other fantastic opportunity we've got as a sector to align with the health and social care system. And we're not talking about more money. We're talking about spending the existing money and getting more for it. So it should really be, to use one of your terms, James, a no-brainer.
Yeah, no, absolutely, Mark. And I think you both heard me speak about going back into operations 20 years ago when we were doing great things because the money was there. And I think sometimes we've been a victim of our success as a sector, i.e. we've operated and performed well, took the commercial challenge on the chin, made the money, but the money that's been made has never been reinvested in delivering those more and better outcomes, Mark. It's just reduced subsidy, gone to the lowest common denominator and plugged the gap that exists in other public sector services. So I do sometimes feel a little bit sorry for our sector in that basis, that we have been a victim of our success, because if all of that great commerciality would have been ring-fenced, I can absolutely say with 100% confidence we would be delivering on those more and better outcomes. Obviously, Mark, we've got to look at how we do that differently now. Kenny, from your perspective, obviously the question is very much at an operator-driven level there, but from your observations within UK Active supporting members, how do you see that balance being influenced, the more outcomes, the better outcomes for less cost, so to speak? And how are you seeing the conversations being influenced within government, within Department of Health, Work and Pensions, DCMS and other stakeholders?
Yeah, I mean, the evidence is there. The ROI that Andy mentioned, the qualities, physical activity is well evidenced, and the benefits of that is well evidenced. The alternative of not engaging us or physical activity, any physical activity, programs or interventions for supporting healthcare is much more expensive if they don't. And we have, for instance, we have on our MSK hubs a NICE approved intervention called escape pain. You know, what more do the government need, or DHSC need, to scale that and other interventions that have similar evidence behind it? As I said earlier in my presentation, they are taking notice a little bit more now because the conversation is much more mature. But there is also a need for them, I say them, government, to look at alternatives like this. The evidence is there. In summary, we don't really need to go elsewhere.
Fully get that. Thank you, Kenny. I'm going to wrap up with one final question. And it would be, apologies here, Kenny, because it is probably directed more at Mark and Andy. But what tips would you give, having, Mark, you've led multiple organisations, progressive, made change, seen the pitfalls, seen the challenges and found a path through it. Andy, the same, and on a wider level within GM Active, and now looking and reflecting on a consultative level. So what tip, looking back, would you give people who are in the operator shoes? I don't like calling it the operator, but managing these services, delivering these outcomes, on having that ability to pivot from being what we call a leisure provider, and going back to your comment, a leisure centre is a thing of the past, arguably. Andy, so what tips would you give personally on what worked for you, moving from a leisure provider to what we may call an active wellbeing provider?
I'll jump in first. I've said it before, James. I think you're not alone. I think if you try and do this on your own, you fail, and it'll be really frustrating. So there's organisations out there. So I think it's that place-based, whether you get any funding and help to do this, because we didn't initially. I think it's a case of, and I have to say again, the best leisure operators will be doing, they'll be going, yeah, we do that. Link with other people. So I'd start with your active partnership, because the whole point of an active partnership, and we've all got one, and they're all very different, but link with them and make sure that you're getting that support from them. They can access funding. They've got expertise that they can pull down. And then that place-based approach where you say, who are the other organisations out there, the voluntary sectors, the church groups, there's a whole load of people who would say, look, actually, I want to be involved in igniting a place, getting a movement going for movement, as they say, and making that collaboration, create the common purpose, and then the conditions that you need to actually take stock of. There is actually a tool that's come out of the local pilots that is the 10 conditions that Sport England have identified through this work over the last 4 or 5 years, that says, look, if you can actually audit yourself in a place against these 10 conditions, and it will give you, like any audit, a starting point, and then you can build an action plan to say, well, what have we got to do that? And a shameless plug, we can help you do that at Miova. That's what we do. So if you want some help on that, any type of organisation, do that, or just look it up on the Sport England local pilot information, and you can do that. But don't think you can do it on your own. Work with your active partnerships. Start there.
Great advice, Andy. Mark, anything to add to that? Solid advice there.
Very solid advice, yeah. And Andy, again, talks about purpose. And the reason why he does that is because he's people orientated, and so am I. So what we both know as leaders is that if you get your people passionate about the purpose, bought into a shared vision, then you're only going to succeed. Obviously, you need to put the plan in behind that vision, but that's my key piece of advice, really. But just extending really on what Andy's just said, I think, practically there's a twin. If you're a leisure operator or a senior leisure manager, you're trying to look at the service and how you pivot. You've got to have a twin track approach. Practically, you've got to look after your core proposition, which is operating your pool, your swimming lessons, your gym, You know, you've got to do that because you've got to be able to pay the bills and deliver the requirement for the client. What you then need to do is create the space to do the transformational piece and be realistic about how long that's going to take. So I've shared today our strategy, Revitalise and Reinvent. That talks all about the transformational stuff. There's actually a lot of other documents we've got that are really dry, hardcore business plans, which say, this is our sales, you know, this is our driving, swimming lessons, gym memberships, Turkish baths, you know, all the other stuff. That is there and that is embedded. That's one track. The other stuff is the transformational piece. And I think Andy said it before, you know, it's how you tactically invest as an organization to give some people in the organization a leadership and development role to drive that transformational bit, because the operational teams are just too busy. They're not going to do it. You need to create that other strand in the business to do that. So that's the practical tip I would give. But absolutely, as Andy said, it's all about the people, it's about the purpose, and it's about building the network. You know, and there's so much stuff out there now, we don't have to reinvent the wheel. There is examples of amazing practice all around the country. It's how you mobilize that locally in your transformational plan.
Thank you for that, Mark. And it seems like a good point to wrap up there with that people, purpose and passion as an end note, Mark. They're going to be the three things that will certainly help us to facilitate that change over the coming years. And can I say, Kenny, thank you very much. It's great to have ukactive represented and hear the voice from a national perspective. I know you're doing a great job representing members, and I'm sure members will have plenty of questions to bring back to the table. Mark, Andy, keep flying the amazing flag that you've been flying in this sector for decades, and I'm not giving ages away there, but you know, I look forward to spending time with you in my career and seeing out our careers together and hoping we can continue to make a difference. Brief shout out to my colleague John Lever from Alliance, who's been in the background and helped support this event and pulling the content together. So thank you for that, John. And of course, to our webinar organisers, Richard and the Y Sports team, for allowing this platform to be put forward. And the last thanks, of course, is to everybody who's attended the session during what I'm sure is an incredibly busy day for everybody. So we do appreciate you taking the time out of your day to listen to us. Hopefully it's stimulated some debate for you. Hopefully it's given you some thoughts, and the Y Sports team will ensure that the webinar session as recorded is shared with you. And please delve into the chat. There are a lot of links that have been shared with some great information. But with that, we will say adieu. Have a great afternoon and good rest of the week, everybody. And thanks for your time.